My name's Carmel and I'm a staff nurse on a trauma orthopaedic ward. We look after all kinds of people from all walks of life who have had injuries, they've broken bones and possibly need an operation or rehab and physio and occupational therapy before they can go home. At the moment, our patients may be that they have hurt themselves and come to the ward and still might have a diagnosis or symptoms of COVID-19. So we don't know how that is going to work or how they will present and how we will look after them. I suppose being a surgical ward, we have that consideration that we have lots of wounds to look after and we have to be very clean and will we have enough PPE to go round to protect us and our patients and everyone else that comes through. People are frightened about going to work and I am as well. I have people at home who rely on me. I have my mum and dad and sister and my son, and we all have complex health needs. We have some respiratory needs in the house. My mum especially has COPD, and I'm worried that if I go to work, am I endangering her by bringing something back to her? And what if she gets sick? But then I need to go to work and I need to help everyone there as well. So I'm conflicted and worried and feeling guilty about being conflicted and feeling guilty about being scared. And I think my mind's a little bit of a mess at the minute. I've had a really tough day today. I had a patient who came in with a broken hip and with symptoms of COVID-19. An elderly lady who was in lots of pain and quite hard of hearing, and her eyesight's really poor. So she must have been really frightened seeing me in a gown and a mask kind of coming towards her. Obviously visiting hours are restricted so that we can limit the amount of people coming into the hospital, and I totally appreciate that. But I just really felt for this little old lady. She was really frightened and I just wanted to squeeze her. Which probably wouldn't have been appreciated because she got a broken hip. So that was really difficult, and I spent a lot of the day looking after her and a few other patients who were frustrated possibly at being kind of in a lockdown situation where they couldn't move about or do anything because we were worried about their symptoms, and one had a high temperature and being in a lot of pain pre-operation is really difficult, and I understand that. Just trying to get the message across to them that we were all doing our very best was really hard. Hopefully tomorrow will be better. So I volunteer with the Royal College of Nursing, and I am active within our branch and I am a steward within my hospital. And over the past few days I've had lots and lots of messages. I'm probably up to about 250 messages now from people who are frightened about coming into work and frightened of staying at home, frightened of what's happening with their families and what would happen to them if they go off sick. So I put a little shout out on social media this evening just to say thank you to everybody for being amazing, and I hope that goes down okay. And maybe it's my job at the minute to just try and bring a little positivity. We'll see how I can do that. So we've just been outside and the whole street has been clapping for our Clap Our Carers time, and I'm just massively overwhelmed and really grateful that people are recognising what's happening in the NHS and across the care sector at the moment, and the people are working really hard. I hope everybody in my branch and within my teams has seen this, because I think people really need a massive uplift at the minute. I'm actually just really overwhelmed. So yesterday I made the decision to move out of my house with my mum and dad and sister and my son in order to keep them safe. So I have spent the morning unpacking at my other sister's house, who is also a nurse. So we will be living together for the foreseeable future. And I have left my family behind so that they can be safe and away from infection. And I am utterly heartbroken.